Registered dietitian Dr. Chris Mohr.
And I'm Dr. Kara Mohr.
And we are so excited to be here today. We're talking all about our upcoming course, which is Lifestyle as Medicine. And you can see there's a way to register right up here. Sorry for pointing in front of your face. Scan that QR code in, and you can register for this course coming in just a few short weeks. But it is all about the importance of lifestyle, as it says, as medicine. Now, we're going to talk about a whole variety of topics, from nutrition to stress and movement and behavior change, and really trying to help people understand why this is so important for their own patients, for themselves as well, for their clients. You know, when we start to think about and talk about lifestyle as medicine, we've been doing this for a very, very long time and talking about this overall concept of well-being. But what are some of the things that you think of? I know for me, my answer is, what are some of the things that you think of when we talk about and understand why lifestyle is so important when we think about well-being for people?
Well, I think it really does have the most impact, right, in people's lives, because it's what, you go to the doctor, you might get a prescription, or you have this opportunity to speak to a medical professional for 15, 20 minutes. But what you do the rest of the time really can make a difference. And we know it has such a powerful additive effect. And, I was just recently talking to somebody who was talking about going to the doctor and prescriptions and so forth. And not that there's anything wrong with prescription medicine. Let's face it, it is life-saving, right? However, they were just saying that, one of the things that they really lacked was all the other things they could be doing in addition to that medicine to really improve their disease management and really improve their overall outcomes.
Yeah, and that's exactly what we're going to be talking about. Again, how do you do this with nutrition? How do you do that with exercise? How do you make both of those work when we think about behavior change? That might be the most important piece to the puzzle, right? So many people know how to do it. And especially as healthcare practitioners, you may understand this as well, but sometimes it's implementing that information to your patients and getting it across to them to understand how they can balance their own lives, again, around stress, around exercise, around nutrition, around behavior change, and those various components of that topic. So,
yeah. I was just going to say, well, behavior change is my jam, right? It's my favorite thing to talk about. And I actually think that despite all the things we know, people know so many things, and you have so much great information to give your patients and to help them improve their lives. And yet it's the implementation of that. It's really understanding how that new recommendation, that new strategy can fit within their lifestyle, and really understanding the ways and strategies we can help them apply that and adopt it, given the demands and everything else people have going on in their lives. So it's really my favorite thing to talk about. And I think it's probably one of the greatest tools we have in this, not to, kind of elevate that above other things. But I think the understanding of how do we help people make those behaviors long-term, long-lasting, and then continue to adopt more so that they can really see the impact of these changes within their lives.
Yeah, exactly. And that's, as we've been doing this for so many years now, to combined experience of 30 plus, 40 plus years, really. That says we're old, I guess. But, really the questions we always get are around, again, how do you sort through this information? How do you, like Kara said, how do you make this stick? So certainly, as I say, the questions we get, if you have questions, if you're watching this, please throw them in. We'll be happy to answer your questions that might come in about the program. Again, there's a registration. Maybe you can point right up there, so it's above your head. Yeah. Scan that QR code. This is upcoming, just a few short weeks. For healthcare practitioners, you can get a whole lot of CEU credits as well, which is another bonus. But then again, can it help you? Can it help your patients can navigate some of this confusing world of well-being? And again, as we call it, lifestyle as medicine.
Well, I think the beauty of this course is that anyone taking it, not only would you get CEU credits, but you would also have the ability to apply this information into your own lives. And,
right.
And your lives are busy. They're full of demands and lots of challenges. And so understanding how you can make those small tweaks to not only help your patients, but also help yourselves, I think is one of the coolest things about this course.
Right. Absolutely. It's been fun creating it. It's been fun designing it and working with some of our team to help put some of these pieces together. And it's loaded with, references and all this information that, again, can be applied immediately, which is the best part for your patients, but then also for you as well. So again, if you have questions, please drop them in. We'll be happy to answer those. And actually, as I said, that one just popped up. let's see, most people know they should exercise, eat better, stop smoking, do quote all the things, but it can be hard to take the first step. What are the best ways to get people in action toward their goals? Great question. You want to take that?
Yeah, and I think one of the greatest things is to really identify and uncover that powerful why. That I think a lot of times we just assume that because we know it's important, or we know that it'll have powerful impact, or our patients even know, like, yes, I want the outcome. I want that in my life, and I want to see these changes. I think a lot of times we don't undercover or uncover a meaningful why as to what difference this is going to really make for the patient and why it matters to them. And so what I'm really talking about here is, you might be talking to a patient about losing weight, and they might be, this might be something that they've said for 15, 20 years. It is part of their narrative of who they are. They understand that they should lose weight, that they would get benefit from it. But it's not until you start to uncover the fact that who they see themselves as is a person who wants to be active and play with their grandkids, and that you can connect those two pieces, right? And you can really help them see this identity of who they want to be in their life and what things they want to be able to do, that you really begin to help people make that change. And so part of this is that we talk about that, understanding what people's motivation is, understanding a little bit about motivational interviewing, so we can understand that for most of us, there's things that we want to do, and then there's a lot of things we don't want to do. So even when we want to make change, we're conflicted about it, because it's going to mean that we're going to have to change something within our lifestyle that we maybe get some benefit from or really enjoy.
Yeah, and that's exactly the key there is, figuring out that identity and what that looks like. And that's so much of what we're talking about, right? Taking these steps and making them actionable so they can be applied. Like I said, starting today, right? Or starting as soon as we start learning some of this information and applying it, that is the key. So great question. Please drop any others you have in there. One of the things that I'll bring up as we're waiting, because I know lots of people are on here, which is we appreciate you checking in. One of the things that people ask so much, and maybe we could both tackle this one, is, when they want to start something, they start to think about, like, I want to do all the things and dive in. And then people are like, but if it takes too long, if these small changes, do they really mean anything? Do they really have an impact? I don't know. What do you think to that?
I mean, I always tell people in seminars and programs and so forth that I can literally change their life with this one piece of advice, which is start small. I mean, it is small, consistent changes that we can do day in and day out, that we can repeat over and over and build that consistency to really see that impact, is what will make a huge difference.
Yeah.
And yet people want to have like this massive overnight change. But, I always remind people that to make massive overnight changes, you need to have massive amounts of space and time and freedom in your life to be able to accommodate all of that at once. And none of us, I have yet to encounter anyone who has that kind of freedom or time.
Right. Absolutely. And these, again, we always say the small changes do equal big results, and it's not going to happen overnight, and that's okay, because if they take a little bit longer, they're usually more likely to stick, which is great. So another question pop in. If lifestyle medicine is so powerful, why doesn't it feel like a focus in my appointments? Yeah, this is, we wish it was, but again, there's a lot of factors that go into that. And it's not necessarily as easy as just, why doesn't the healthcare practitioner, your nurse, physician, PT, whoever it might be, just spend all the time with me talking about all this lifestyle medicine? Well, one of the things that we're going to talk about is, and going back to what we just said, is what are these small changes we can implement? So, maybe it isn't, like Kara said, overhauling your entire life, because we have so much time in the world, but maybe I'm, with a nurse, I'm with a PT, not necessarily there to talk about lifestyle medicine, but what if there's that one thing that they can suggest that may start you down the road? What if there's that one thing that can help that ball get rolling? So unfortunately, it's not a focus of a lot of appointments, because medicine, most, westernized medicine, people don't have a lot of time to spend with patients, unfortunately. There's exceptions, but in general. So within that short time frame, what are these things that we can share with our patients? What is this information we can share that they can implement right away and make change?
And if you feel frustrated in these appointments, not being able to have these conversations, or if you feel like that you can deliver more to your patients, this is the course that will allow you to do that. This is the information that you can have in your fingertips, in your back pocket, where you can begin to, pepper this information along the way and use it to really help your patients make the changes that can make a big difference in addition to all the other things that they're doing.
Yeah, that's the exact goal. That is our 100% our goal with this course. Certainly to share this information with you. Again, it is September 20th and 21st. So coming up right around the corner. You can see that QR code right in the corner to register. So take advantage of that. I do see another question just popped up again before I was going to wrap up, but another question. I want to take these. What can I do differently to help my patients implement a lifestyle medicine approach? My time with patients often feels limited.
So I think one of the most important things we can do is we can give them tools to be thinking about and things to take with them to begin to apply this information and, asking different questions. It's all about the way in which we're phrasing things to get people to see that they can open the door of possibility for themselves. So we walk through that in terms of what you can add. What are the conversation starters that you can begin to have? What kinds of things can you have your patients doing on their own to be thinking about and applying in between visits that they can really begin to see the impact of these changes?
Yeah, and that's exactly what we're thinking about here. So please encourage you to join us September 20th and 21st. We're talking about lifestyle as medicine. How can you better help your patients? It's going to be an in-depth course that covers a lot, but we're going to have some fun as well. So remember, register right in that QR code right in the corner.
Or you can see the link below.
And we look forward to seeing you in just a few weeks.